Good afternoon. Happy Thursday, everyone. It's Wellness Wednesday, or it's Thursday, so we have our focus on health. A generic drug is a medication with the same active ingredient as the brand name drug. I think you all know that. It's taken the same way and offers the same effect, but we do have Dr. Quinn today to explain more about why medical providers are prescribing generic medications to their patients. Interesting topic. I like this one today, Dr. Quinn. So why is that the case? Why are medical providers prescribing generic options of medications?
The reason we medical providers are prescribing these generic options to our patients is, number one, we care about our patients and we want to help them in the best way possible. Now, the deal is the generic medication, as you noted, has the same active ingredient and is just as effective, verified by the FDA. But in a lot of cases, the brand medication is not covered. So we're going to go with the least expensive option if it works, which it does, and try to avoid prescribing the brand medication, which is so much more expensive. A scenario where if we just go straight to the brand, it might not be covered. That same patient might not be able to get their medication filled. And this same patient might have hypertension, diabetes, or some other chronic medical condition that's not being treated. And now that person is at risk. That's why we always try to defer to the generic first if possible.
Now, you had already mentioned that those versions are just as effective, but are there any potential disadvantages?
There can be. And I've seen this over my last 20 years of practicing family medicine, where we've gone with the generic and the patient may have had an adverse event. The deal is with the brand medication, the active ingredients are the same and they're verified to be just as effective, but those inactive ingredients might be different, which causes the generics in some cases to have a different size, color, or shape. And these inactive ingredients might not agree with the patient. In that event, the patient would come in and say, hey, doc, this medicine is making me feel a little tired, or maybe I'm coughing, or any other adverse event. In that scenario, we would get that prior authorization and go for that brand medication, especially if they've taken the brand in the past. And in a lot of cases, we can get it covered. But this is very rare. Overwhelmingly, I'd say 90% of our patients take generic medications with no adverse events. But when this does happen, we can remedy it.
I definitely take generic medications, just, when it's available. What about newer medications, though, Dr. Quinn, that do not have generic alternatives? What do you do to try to help your patients save money?
Well, basically, as I said before, we have scenarios where patients would be optimal to take the brand medication, especially now with the new classes of medications, especially those GLP-1s like your Ozempic, your Rybelsus, and these are for diabetes, and that new medicine for weight loss, Wegovy. There are no generic alternatives. In that case, we would get that prior authorization where we have to articulate to the insurance company why the patient needs the medicine, how they would benefit clinically, and that there are no generic alternatives. And in a lot of cases, the medicine is covered. But overwhelmingly, across the board, we try to do the generic medication if it's available. And I had one patient that had questions like, why are you giving me the less expensive medicine? Do you know who I am? She was going on. I said, listen, ma'am, I don't wear Gucci shoes. I just wear nice shoes from Dillard's. They walk just as everything is great. And she kind of laughed. But the take home is, if we can save the patients money, if we can help them get the medicine they need, as medical providers, we're going to do that.
And we appreciate it as patients. Thanks so much, Dr. Quinn. Appreciate your time always.